Hi, I am very happy to attend this seminar, and it is it is very happy that I have got a chance to say my views with the presentation. The topic is very much relevant to the current situation. Thank you. So welcome to all. I first of all would like to thank Professor Jama Melvin for giving this opportunity to say my points on and my experiences to share in this presentation. Thank you so much, sir. And at my time of college, Professor Sam Santosh, who has given a spark on the HR area. So I would like to thank him too in this current situation. And Professor C.T. Sam Luther, who was leading the department at my time of management studies. So these are very important people at my management studies time. And this college, which is NMCC, which is always, which is always emotional and also much connecting organization, which has given a lot of chances to grow, to learn, to start the professional, after the educational life. It has given a lot of ideas to start with a professional life. So, which is an unforgettable organization. And today's topic is business resilience and COVID-19 crisis, a cross-cultural experience. I would like to thank you, Dr. S. John Manoraj, for his wonderful presentation, which was on agri field, and that was very much connecting. And food industry and agri industry is always a prominent industry. Well done presentation on that. I'm able to connect very much on the presentation. And Dr. S. John Felix, financial controller, who has also has done a very good presentation, and which is about the hospitality industry, which is also much connecting. And I know his experience in hospitality industry, so it is a very deep presentation on the area. And I thank you both of them for doing this presentation. And I thank Professor T.B. Thomas. I think he knows me. I was also a part of English department earlier. So I'm very happy to see him in this seminar. And also all the other people who are organizing this seminars, especially the principal, the correspondent, and all the participants who are participating in this presentation. I am so happy that I'm getting a chance to speak to you all. So let's see what actually has happened in the situation of COVID-19. You have seen in other presentations also, there are a lot of declines in business when it comes to shoppers, shopping. This is just a chart which I have shared to you. So you can see there is a very high change in the percentage, which is 32 in China, very low percentages, which we can easily see in this chart. So I'm not going through these charts deep, but there are other things which is gonna come up. So it will be always good to see in that. The oil price in 2020 has also went into a dip on April, May, because of the full, the stuck in the transportation and logistic field for a short time. And then this is just chart for you for the review. And flight picking up again. So you can see that in 2020, the red line which is showing here, this is how the flight, also the industry, the aviation industry, which went down and came up. It got bad to previous years. It is because of the pandemic. So link hiring, which is very, you can see, for example, a country as a sample, US, how the curve has gone below. So the unemployment rates are increasing. In Japan, 2.4 to 3. This, like in US, it is 3.7 to 10.5, 10.4. So stock markets also, there are very high losses and dips are shown in this chart. And this is COVID-19 especially threatening which sectors, or like how the risk factors of each sectors, which is shown in this slide, where, for example, you can see this color, which is D. D belongs to, here it is construction. So in construction, it is a medium, it's a high risk. It's a high risk field. It is less of, you can see it is less affected, but the financial risk is high over there. The COVID has directly not impacted the construction industry, but then there is a high financial risk. Due to that, the construction has gone down. And then the more affected areas, let's say this one, it's accommodation and food service industry, which is accommodation, which comes under hospitality. Even Felix was mentioning that. And when it comes to this color, less affected, but lower financial risk. Let's take this as a sample M, which is professional services. So a lot of professional services, which has which is less affected, but has a lower financial risk. Then this color, it's more affected and lower financial risk. Let's take G as a sample, which is healthcare, which is my field as of the moment, and which is so much connected to the COVID field, the situation. So healthcare is one of the major sector which actually strives hard to bring this COVID down, and which is a relevant discussion which I can have in this with my experience in the particular industry. And it is time of healthcare which has to bring this COVID down. Also, healthcare industry, it's an emergency kind of industry where there is a lot of emergency treatments has to be done for a lot of people in the country. So which comes to U.A.E, there are a lot of different kind of treatments which happens because of COVID-19. Even this business of the hospital industry or the healthcare industry is going little down, but we have picked it in the last 3-4 months time. So how we went into the dip and how we have raised to a different, how we have came out of this. And when it comes to COVID in U.A.E, we got affected from March, and then in April and May, it was a little difficult time. And by the second mid of May, it was better, that it went little in a good situation. But we are able to handle the current situation in U.A.E. So I just want to show you a short video about how this economy is going to come up, or how we are going to recover. Hello. So I think you have seen the video, which is showing that the economy will raise up, or it has fallen into a different way, and so for some industry it will be a V, for some industry it will be a U, and for some industry it is a W, and so this is a idea from Anas Daily, which is high performing platform video, which is normally uploaded in Facebook and YouTube. So most of you would have known about this. But then my opinion on this curve, how this goes, is it a U, V, or a W, or as he said in this video, is it gonna be a tick shape or a Nike shoe, a symbol shape? So my opinion on this is it based on the industry. So when it comes to my healthcare industry, this has gone as a V. For some industries, if there is a loss and profit and it goes up and down, then it will be a W. Let's say industries like hospitality, it can be a tick shape kind of, which is which will slowly, which will emerge. Maybe it can take to 1 year or 2 years. That is up to the COVID situation. So now comes the topic. This is the start of the presentation, where the business resilience and COVID-19 crisis, a cross-cultural experience. So now we go a little faster. Building business resilience in response to COVID-19. How to build a business resilience in response to COVID-19. So the topic is about how to get a quick recovery from your dip business to to bring it in a profitable way. What are the techniques a person has to follow? So I think most of the people who are viewing this seminar are students. If you might not be able to connect this, just think from a perspective that you are running a company and you are into this crisis, and how you are going to pick up from this crisis. So then you will be able to connect to this presentation, and people who are running the business will much more better connect to this, because this is a little specific, relevant to a general business concept of how business which went down in this COVID can come up, and what are the techniques to be followed to bring this business resilience. So next 15-20 minutes, please watch the presentation so carefully. I will be saying a lot of points, how a person can improve his business. It can be any field, where I will be touching some areas of the healthcare, which is from my experience too. But then this presentation is all about how you can improve your business from all the perspectives and from all the revenue generating concepts. So monitor the situation. So in this current pandemic situation, you should always know what is the what are the issues, what are the things which affects your business. The business continuity. You should know that how to continue with your business, like designing a new streams, revenue streams, or it can be maintaining a sufficient resource. It can be material men or any kind of resource, or keeping a space, or it can be a implementation of work from home concept. So the workforce management is another area where how to review your internal policies to keep the business and understand your employees profile, like how you manage your workforce. That is another area. And the customer, supplier and stakeholders, how you manage this situation from your business, how you manage with your customers, suppliers and stakeholders, and how you manage your cash flow and insurance. Then how you can manage your tax and audit. What are the benefits which are available in the current scenario, that we will be discussing in short, in brief, and how to remain optimistic in the situation and to bring a business resilience. So business continuity life cycle. So when any business is affected, it is because of you are not getting a revenue. When there is no revenue, we can tell that a business got affected. So how to plan for a business continuity? First of all, just analyze what is the problem has happened in the business. Then create a solution to the problem. If there is a problem is known, then you can create a solution. So I will come to this in detail in other coming slides. Implementation. Then once the solution and design is ready, you can implement. And meanwhile, you can test and get acceptance from even though authorities or internally, the acceptance has to be there. And then you can maintain the same concept. If there is any gap, then again it goes for an analysis. So this is a business continuity lifecycle model. So how this business continuity lifecycle model we have used in the healthcare, specifically to my company. So I will be explaining on that too. So here I am sharing some of the old and new revenue streams of hospitals and medical centers, where you can see here, these are the areas which the hospital actually was getting revenue. But then due to the affecting of this COVID, due to the crisis, we were not able to get revenues on these areas because the patients were not coming to hospitals for getting treatments on this, and also the government authorities were not allowing people to come out of their quarantined facilities, even from homes. So due to all this situation, there is a loss in the healthcare sector also. But in reality, there is a COVID. There are areas where the healthcare has to focus in the current situation, where it is especially COVID. Even though the other areas cannot be focused on, apart from the emergency cases. The company has brought this new revenue streams into place, which is like COVID testing for the patients, and home care services, which is like anybody can call to a hospital, or they can use a telemed option, which is a third one, where they can have a telemedical consultation, and then if it is required, then the doctor will go to the home, or the nurses can help out these people who are affected due to COVID or any other health disorders. So these new streams has helped the company to bring the revenue again back. So this is a model where the company has thought, okay, there are old kind of revenue models where they were not able to achieve, but this new kind of revenue models, they were able to achieve the revenue back. So said in the previous presentations also, the agri business, how the marketing, the way of different marketing concepts when it is used, how the products can be sold. Comes to the HR area, the workforce management, how we were able to manage this workforce in the current situation. So the healthcare industry is it's very prone to this particular situation, and there are a lot of frontliners staff who will directly deal with this COVID situation. So how we managed to keep our workforce in the company. So that this explanation is about that. This slide is about that. So normally, like when the business is down and suddenly when it comes up, and with the COVID situation and other business, there are a lot of growth coming in suddenly. We have a less number of people, and let's say the COVID people, which are more people are coming and getting, they are admitted into the hospitals. With the less employees, we might have a difficulty in managing the patients. So always there is a reskilling kind of, like for example, a customer service person who is working in a hospital can also do a insurance area part. So multitasking, which is very important in the situation. So that is one point which I have to explain. And the other one is that changing leadership and management competencies. So here what happened was like, now most of the people are working from home. Even in healthcare sectors, there are front office, back offices also. There are support functions also. So people who are working from home, where the company has given a lot of responsibility, but at the same time, a free hand is given to those employees who work from home. And even at the same time, it is a full it is upon them, like there is no leadership who is physically present to explain to them or to get the job done from them. But there are various techniques which we have followed to manage the workforce. So there is a change in the leadership and the management competencies has happened in the situation. And a culture of trust, transparency, and openness, which has happened in this current situation. The individual social and mental and physical well-being is also very important, because many of our back office staffs are in their home facilities. They were working from home. So at the same time, they have to be in a mental health and in a good physical health. So we have taken some steps for that. That will be explained in the next slide. And the last is the working in a more agile way. So this is also about the work from home concept. So how we have managed this, I will just show in the next. These are the changes which happened in the workforce management. How we managed our workforce. Communicated with employees to raise awareness. We have communicated with employees that there is a COVID spread which is happening in the month of March when they started. So we have given a lot of information to the employees about the travel restrictions and the flexible hours and how we can do a job rotation, and all this were explained to the employees. We developed and performed a remote task kind of meetings, and like now we have trained them how to work in remote, actually how you can manage your work in a remote locations. We have issued from the company for them laptops, and for some people the desktops were arranged at their home. And still the healthcare is very important, which has to push into sorting the COVID situation, and we have to sort out all the COVID problems. So this kind of work from home concepts, which has been like in 15-20 days time, the company has done it to manage the situation. And then monitor the situation and brief our employees, which we have done also. We have asked our employees to update the contact informations, because in the situation anything can happen to the employee, and the records has to be latest updated, where in this situation, so that the company can always contact them through the remote ways. So we have we have a internal facility, and the facility is used to collect the data of all the employees. It's not only their contacts, but then there are a lot of personal data, their blood groups and all that, to sort their problems whenever it is necessary. And so we have conducted other kind of trainings which is related to pandemic. So we have a quality department which has helped in conducting this pandemic kind of training. And health and safety of employees is very important at the situation. So we have checked into all the insurance of all the employees, that which we have managed to do. And disaster management situation, we have explained to the employees, if something happens in the business, if the losses goes very less, then we will be in a situation to even make some positions redundant. So we have even explained to them that there are some situations might arise, so they have to be careful at all times. And even the company has arranged a lot of online recruitment drives for people, if anybody who is in a redundant position, which we have managed. So what we have done to cope up with this work from home concept, there are ways we have done for customers and public. The IT support, the tools used to in the business. So these are some tools. Like example, telemed was a new concept which was introduced for customer and public. So this you can see, that is a Medcare logo, and this is a telemed new software which was just a kind of a new app which was put in the Google Play Store. So they were all the patients were able to access the the consultancy areas of our hospital through remote locations. Even Aster is our parent company which has done the same. And there is an Aster Volunteers which is as a CSR we are doing for the society, especially U.A.E and India. And then also there are a lot of immunity booster e-guides which we have released in various social platforms. And for employees, we have trained in many areas of like how to work from home and what softwares can be used. And I think by God's grace, like 1 year back itself, we have implemented a lot of such softwares in the company. So this was so much helpful at this time of COVID. So which was like Microsoft Teams, the same like the Zoom which we are using. So Asset Connect is our ERP, which was recently developed and which was a cloud-based, so that it's not necessary that you have to be in the company itself. You can work from even any country. So Oracle, it is an Oracle-based platform which we have developed inside the company based on our custom needs. So which was much helpful. And workforce scheduler, which we have implemented in the company, which was very helpful in tracking the employees their attendance, or nowadays it's not about attendance, but then the rotas of the employees that can be created and how easily we can manage the workforce. So these are softwares which has helped in this pandemic situation a lot, even from remote locations. So even IT has provided us with the laptop, mobile phones, which we can use from the home itself. The talent review has happened in between of this, where we have used a software to know who is well talented, who has to be kept, and who has to be taken out from the company, or when the company comes into a very low situation. So we have even we have even managed that with this kind of softwares. And then lot of office related softwares, which is always useful, uh, not only at COVID and even from apart from that. Here very specifically this SharePoint, which was much helpful to share a lot of policies to employees at this current situation, how they have to manage their work, even from home or from office or from the hospitals. So we are the major industry where even in the COVID situation, we have to be the frontliner people who has to fight this COVID. Then there is this Visa app, which we have implemented, this app, which is for the mental health of the employees who are working from back office. So this app will have a lot of answers to the questions, and this app is also talks to the employees. Like it can have a mutual, the employee can have a mutual talk with this. There is a app, the penguin shape. This graphical representation will come into the mobile phones and speak with the employees. So such kind of things we have done in this company. And for the physical health, there is a tracking thing which we have done for employees, where if they install this in the mobile phones, where they can actually, we wanted to increase the health of steadiness of the employees. So what we have done for the back office people is that whenever they get time out of work, they have to track their walking and all that, like for a half an hour per day. So this all we have done after the COVID, which gets a little better. So this makes the people healthy, and also their immunity capacity is boosting up. So these kind of things which we have done for our employees too. And the customer, how you manage your customers and your stakeholders in this current situation. Announce your customers about your business. Like we have announced some particular hospitals as the COVID-free hospitals, so that other people can come and get treatments also. So some hospitals we are specially and opened for the COVID purposes only. So such kind of announcements you can make to the customer, suppliers and stakeholders in the situation, which can also bring up your business. And partner with other countries, companies to provide short-term job opportunities. So even when people who are got redundant, very less number of positions got redundant at the time of COVID, when it highly impacted the company. So what we have done for them was that we have talked with some recruitment companies, and the recruitment companies we have made a contract with. These companies will help them in finding a similar job, or the job which is matching to their profile. And we have also taken global actions to bring some 30 nurses from India, especially to take care of this COVID patients who are from U.A.E, who are Indian people also. And then the DHA, the Dubai Health Authority, has helped a lot in this attaining this particular project. And we have also recommended to put the workers first and encourage the government to do so. For example, in U.A.E there is a sick leave payment law, or labor law, which says that employee can take up to 90 days of sick leave if a person is sick, and there is a doctor certificate, where first 15 days will be paid, and the second 30 days will be half paid, and the balance 15 days will be fully unpaid. And the 15 days plus another 15, which is 30 days, will be fully unpaid. So such kind of labor laws are there in the country, where so we even used the we have asked the employees to follow this law at the time of this COVID, but with proper testing of for the employees and all. So this is also a good sign, where we have to show towards our employees, and at the same time we have to take care of our employees' health also. There are CSR donations has happened in this pandemic time from our organization and many other healthcare organizations also. So this is what I have said earlier also, the recruitment drive for the exited people we have done. This is some corporate CSR kind of thing also we have done, plus we have done for our internal employees who has been redundant, or for our customers also we have done a lot of goodwill things to the current situation. And I have to talk about the cash flow management and the insurance, which plays a part in this COVID situation. Like how can you manage your business to bring the cash flows? So when you are making a payment, from the company, try to make a mutual contract with the company which you are gonna make the payment. Like you can ask for an extension of a period when there is a proper mutual agreement between both the sides, so the payments can be paid after a stipulated time, so which is a way of managing a business resilience. And focus on your inventory management, which is very important for any company, to keep your particular inventories or your raw materials or anything at the right time. So which is also very important. So I have just suggested like non-perishable and not perishable materials, which can be managed in different ways. And revisit your capital investment plans. So after this COVID, how can you invest on your, where can you invest, and how can you invest? So this has to be rethinked or revisited. So understand your business interruption insurance. If something happens to your business, so how insurance can cover the loss. So you have to also think from that perspective. Manage and expedite the receivables. So the receivables always has to be brought in faster. So for that you can have different techniques used, like improve the accuracy of your collection process, or make a discounting solutions for those you can able to pay more. Some companies will be able to pay more quickly to you, but with a PDC or kind of with after a long time. So you can make check discountings kind of thing, or there are a lot of discounting solutions which you can make and bring the money faster into the company. And review your variable cost. It's like any company in the current situation will freeze their hirings, which will happen. So you have to look into such areas also, and encourage the employees to take leaves if there is a business, business is low. If you don't want that much employees to work, then you can ask them to go for a short leave period, which has also happened in many industries. And even healthcare, we have done for some staffs which they cannot they are handling the jobs at the back office, but the front office staff, we will not be able to give them the current leaves, and due to the COVID pandemic. So the tax benefits. The tax benefits is all about how the tax payment, like when you how to extend your time on paying the tax, and how this benefits your organization. Like you in the current situation, you always have to extend your payments. So how this government also is supporting on this tax benefit kind of thing, where in the U.A.E there is a VAT tax which is 5%, which is actually paid by the buyer to the seller, and the seller will pay to the government. So here, for example, this is one thing the U.A.E government has done in this VAT thing, is that the VAT, there is a VAT payable which you have to pay to the government, which they have extended for a 1 month time period, to pay. So that is a kind of support which even governments are doing in U.A.E. And this kind of information you can get shared from the government websites too. So this has happened in April, and even the deadline is over at that point, but they have extended from March to April, so which is a 1 month time where the businesses can, if they are not able to pay on time, the taxes can be paid later. So such 18 kind of tax benefits the UAE government has announced for all the businesses. And in India, related to GST, which is under proposed stage only, uh, but in UAE, which is entered into force, but in India also, there are 99 different kind of tax benefits which has uh, been proposed, and some are already into force. So if you look into the tax benefit areas, where you will know such thing, when you look into the statutory areas of tax, you will be knowing about this. Audit and consultancy. These are the audit firms which can help you in bringing up your COVID, how to bring up the COVID situation, instead of making it more worsen, how to how to bring this up. So such things are very important in the current situation. There are a lot of auditing firms who can help you in consulting the ideas with them, and even they can audit your company and find out what are the risks available in your company, and what are the current risks there in the company, and how can you overcome this. So like example, this Deloitte, PricewaterhouseCoopers, or Ernst & Young, KPMG, or Grant Thorntons, all these companies mostly are working with our company also on finding out the risk, and giving us solutions also to bring up, to bring business resilience in the current situation. So governance and structure, the risk assessment, or it can be plans and procedures which has to be created, or it can be a continuous improvement, where we can make, all these areas, they are helping us a lot on bringing the business resilience. And remain optimistic always in this kind of situation. Always be optimistic. Even though COVID is affecting, I know in India, the COVID affecting people are increasing day by day. The same has happened in UAE also, but this was in the month of March. But then now it is in June. We are in a better stage of people are feeling optimistic about it. How? Because of what reasons they are feeling optimistic? It's always think positive, that any problem has always there is a solution for any problem. So you will be able, if a UAE can come up in the situation, for sure, and India can also come up, but then it takes some time, but the people have to remain optimistic. Effort towards self-reliant economies. This is what happening now. People are more willing to go towards self-reliant economies. So to bring up businesses like agri-business, and these are much self-reliant. So there are a lot of opportunities will come up in future. And we know a lot of more now how to manage this disease. Like when it comes at the month of February, March, it was a big question mark how we are gonna sort this disease, or how we are gonna overcome from this disease. But then after a 3-4 months period time, we are all knowing now how a lot of ways where we can stop this spread. The government is suggesting a lot of options too. So everybody has to follow that. So this is also a way where we can think optimistic now, that this is a controllable one, but then we have to follow the steps whichever has been announced by the government or different health authorities. COVID-19 is under control in many countries. If you ask me, it is exactly under control. It is not that way, but then people are able to control in 3-4 months with the less populated countries. It can go for a second wave, but then it is all with the within the people only. if they will follow the rules and the procedures which are in place, then for sure there will be a there will not be a second wave. But then if people are not following the restrictions, then again this second wave may affect in the countries who are even who has even coming out little by little. So remain optimistic for many other reasons also. After this COVID-19, the manufacturing industry is so flexible. Even though even you would have heard there are a lot of business from China is going to come to India, because the manufacturing industry is very important. Like if there is a vast industry, like vast production is happening in the country, uh, then and if there is a proper marketing done within a low cost, we can supply to a lot of countries. India has that capability. So there is a growth for sure in future after this COVID-19. And digital transformation will happen for sure, because everywhere you can see in any business, digital transformation is showing a very prominent role. And the tremendous growth in the healthcare sectors, like in my sector, which has happened, the telemedicine, which is a field which is emerged very recently after the COVID-19 only. That remotely, how can we treat the patients? So this is another area which is growing, which will create a lot of job opportunities. And marketing industry, uh, it's also growing in a very different way. It's bringing up many new customers through online markets. And delivery industry is also having different will for sure improve in future from a different perspective too. And industries like insurance, which has this cloud and digital core system to improve customer service. So the cloud, which is again an IT area which is connected to the insurance, how this is helpful in the COVID-19. Very many developed countries, or in the developing countries also, this concept is being used in a prominent way. And for sure, this is another area where people can feel optimistic that there are a lot of job opportunities. And food industry, which becomes a major which is a major industry, which is gonna uh, boom in future, because food is a major area. And the pharmaceutical industry, as you all know, the people are the scientists are looking for the COVID vaccine, are in steps of finding the COVID vaccine. So the pharmacy industry is gonna grow high. And the fitness industry, now people are in lockdown situation, so the fitness industry will also go high in a very good way. And the e-commerce, which is online platforms, now a lot of payments are happening through online only, because there are lot of meetings between people, or people going to shop has been reduced. And in educational sector, even the presentation what we are doing now is based on the online education. So these are the ways we can feel optimistic. Even though some ways are closed, there are some ways opened. So always feel optimistic, feel uh, uh, happy about the future, which will give a lot of job opportunities and lot of growth.